Dr. Kate with another Form, Function, and Flow Lab podcast. And this one, I kind of wanted to go over the concept of prehab. And it's kind of foreign to the typical healthcare setting because it's just not how insurance is set up, at least with insurance for chiropractic or physical therapy. Typically, insurance companies just do not want anything to do with preventative care when it comes to the musculoskeletal system, or at least in Pennsylvania. You have to have an active issue, and if it's chronic or anything like that, they won't cover that either. They want it to be rehab. So rehab is what we do after you've had an injury or you're recovering from something like that. And even when it comes to the more chronic things like managing the symptoms of, maybe an autoimmune disorder that's not necessarily going to go away, but you want your quality of life to be better, and maybe you get that through treatments and that kind of thing. And in general, I don't practice in a way where I want you to be coming back all the time. I want to give you the tools to change your habits. If you have something in your life, like I treat patients all day, and that's not super ergonomic. I'm bent over people and that kind of thing. So there are things and routines that I do to help prevent an injury, because I don't have the time to take off work to prevent or to rehab an injury. So my thought process is to do these prehab exercises to help me prevent any problems that I think might crop up from just the day-to-day stuff that I do and the stuff that I know about myself, the job that I do, all the driving for the commute that I do. I know where my weak spots are at, and I try to incorporate exercises into my daily routine that's going to prevent that long-term problem from happening. And I, am not immune to falling behind, and it really humbled me a lot last year, because we had a lot going on as a family with buying a new house and all the stuff that goes into remodel and all of those things. So I got away from my prehab routine, and not only do I do prehab for helping to counterbalance how I treat patients every day, I do a prehab routine for bringing stability to my hips. And that is because I have had a history of, I danced my entire life all the way through college. I did gymnastics, and then it was an easy segue from those into really intense yoga, and not yoga where you sit around and stuff it, but really intense postures that relied heavily on my flexibility and arm balances and all of those things. And when you rely more on your flexibility rather than your strength, you can have some ligament laxity. And I usually do prehab exercises to counterbalance that ligament laxity so that I don't lose the centration of my joints. And that's something that I work with patients, is centrating their joints. And basically that just means keeping the joint nice and lined up so it's not rubbing and causing issues, and with the tendons and ligaments attaching around it. And it helps to prevent deterioration. So I know this about myself, that I would have a lot of clunking of my hip, and I have like Gumby detachable hips, my entire life. Could do crazy things, dance, gymnastics, yoga, all of that stuff. So I knew that I needed stability in there to prevent an injury down the road. And nobody wants a hip replacement at a young age, because those do have a time limit on them for how long they last. So I got lazy, stopped doing the stuff that I know that helps me keep my hips centrated and the ligament laxity from being an issue. And all of a sudden, 6 months later, I had excruciating, sharp, can't sleep through it. I could barely spread my legs far enough to sit on the ball that I use to treat patients. So it was a stark, like, your prehab exercises work, Kate. But it was, definitely a wake-up call, and showed me that, I'm not immune to the same things that my patients deal with. And, having to rehab that issue was much harder, infinitely harder than just doing a 10-15 minute routine to keep my hips centrated every day. Because it was, I have full range of motion, almost, I'd say 90% back since having this happen in February, but it was a long road, and it took a lot more effort than it took to just avoid it happening in the first place. So that's my example of prehab for myself. And now, if you don't have a great understanding of the body and that kind of thing, it's hard to pick out what prehab exercises should I do. But if you go to a chiropractor or physical therapist, or even a very knowledgeable Pilates instructor or yoga instructor, depending on what their background is, whatever movement professional that you go to can usually look at your movement pattern just in front of them, but also by taking a history and seeing, do you drive for work? Do you sit a lot? Are you bent over a phone or a screen or anything like that for long periods of time? And then they can help you to figure out where are your weak spots and what might become a problem later, so that you don't have to stop what you're doing. Because that's the other big thing. When you wait till it's a rehab issue, you usually have to stop the things that you love, and nobody wants to do that. I didn't want to do that. That was miserable. So being able to do prehab exercises before it becomes a problem, then you're able to do all the things that you love. Run, swim, cycle, pick up your kids, get down on the floor to play with them. Those are, I think, things that sometimes people just take off the table because it's painful, and they just kind of say, okay, I can't do that anymore. Oh my gosh, that should not be how we live life. We should want to get back to how we were able to function, so that we can still do the things that we love, because it should be a life skill that everyone should be able to be able to get down onto the floor and get back up off of the floor. And often people will come in to the office and, we go over exercises. So I ask, can you comfortably get on the ground and back up off the ground? Because a lot of the stuff that we do exercise-wise involves getting on the ground. And it's funny because some people might think that they can do it, but they haven't done it a long time. And then when they go to actually do it, they're like, oh my goodness, this was way more challenging than I thought it was going to be. And it's a good little check-in every day to get all the way down onto the ground and all the way back up. And how hard is it? How many things do you have to put down or reach for to get up and down off of the floor? I took a rock tape seminar once, and their test, I forget, it escapes me what study this was, but it was like a study on your mortality, and it graded you on how you were able to get down onto the floor without touching anything and get back up without touching anything. So without taking a knee, and you'd start, I think the grading scale was like 10, and then each time you had to put a knee down, a hand down, or whatever, took a point off. And it is definitely eye-opening, and lots of people aren't able to do a perfect score, but it's a good check-in to see, can I do it? How easy is it? And how many things do I have to put down on my way up and down? And definitely a good little benchmark as you go along. And if you do have difficulty, before you start having pain or whatever, what kind of prehab things can you do to keep your mobility? Because mobility is going to keep you young and keep your joints lubricated and young, and it's just so important. And I can't stress it enough. And we have a heavy focus here on the pre and postpartum patient. A postpartum patient is you're never not postpartum, so it goes throughout. But prehab, I feel like, is super important when you're prenatal, because you might not have issues, but you don't want issues. You want to learn the tools that you're going to use after you deliver the baby, so that it just is this, much easier flow through that whole difficult transition, rather than waiting till, oh my gosh, I have this excruciating SI joint pain. Well, maybe you wouldn't have if you had done some of the core concepts to stabilize yourself. So there's that aspect with that niche that I work with, but there's also just everyday people, no matter who they are, and I'm talking all the way down to kids. I do see kids in the office. I see all ages. I have a lot of pediatric training, so I do treat infants, not so much with infants, but with the kids that have started into sports and that kind of thing. A lot of the sports that I see kids do can be a little imbalanced, and you don't want to wait until you have an injury, because then you're maybe out for the season, or you're not able to play a few games, or even it's hard to rehab it once it's already occurred. But if like I am a pitcher, we can give you stuff that will help counterbalance all that asymmetry that you're creating in your body by doing this one-sided activity. Or like swimmers, they have a lot of shoulder rounding and tightening through the front side of the body, and giving them stuff to open up the chest and create that balance. It's all about balance and symmetry. We don't want you to always be standing rigidly and holding ourselves rigid in one way. We want that balance and ability to be mobile and move fluidly. So much easier for kids that have a sport that might be a little asymmetrical to incorporate some prehab stuff, so that they don't have to maybe take some time out of their season to rehab an injury. And that's, throwing sports comes to mind because it's, that's asymmetrical, but it's even, with running. I see lots of runners because maybe their, gait is a little off, or, a lot of times I see in high school kids, they have good intentions in practice, and they do core training, but then their core training is pretty asymmetrical, and it's all crunching and that kind of thing. And when you're trying to train your intra-abdominal pressure to be really on point, crunching is not going to do it. It's going to maybe make it a little asymmetrical and not use that crisscross support system of both sets of obliques and the transverse abdominis. And then, hey, what about your low back that also contributes to how your core functions? So all those good intentions of doing the cross training and core work that they do before every practice might actually create a problem. So yeah, the concept of, I wish the concept of prehab would become the norm so that people can continue doing the things they love, try to pinpoint some of their weak spots and address it before it becomes an issue. And, you know, insurance is definitely, you know, I think we get wrapped up in how the insurance company goes after treating issues. And there's no way that they're going to let people come in for treatment when they don't even have an issue yet, when they're predicting an issue. I mean, it's a little short-sighted in my view, because they're going to end up spending way more by having us have to treat longer and more intensely for an injury, and so it might even actually end up costing them more. So, or, you know, with the, like I was talking about, the chronic pain patients, like people with autoimmune diseases, they might get relief from us and it might cost them, you know, this amount each month. But what about the medications that they're on? That also costs money each month. Or if they get put on disability because they can't function, you know, with the pain level that they have. So it's a broken system, and that's why I want to start making these courses to help people take ownership of their own health. Because if you really want to be active and pain-free and mobile, it's kind of on you to search that out and try to incorporate that into your lifestyle, because it's not going to come from your insurance. Insurance doesn't care about your issues until it is a full-blown injury from the musculoskeletal point of view. And I feel like it's just a losing battle to treat that way. So the course that I have, a low back course, that's great if you're, you know, sedentary at work and those kind of things. And it's a more short course. And then I have a pelvic floor, diastasis recti, and C-section course coming out that's geared towards those people that want to address stuff in an easy way on their own. You know, it could be if your kid's up at 2 in the morning and that's when you have a free 30 minutes and you do it then, or you do it when the kids have gone to bed and, you know, PTs and chiropractors aren't open then. So I wanted to make it accessible, and I really enjoy putting that stuff together, and I think that it'll be more cost effective for people, and it kind of gets around that insurance mindset of like, let's wait until something is terribly wrong with you before we address it. So that's my little take on prehab, because I do call things like prehab exercises or whatever in my videos and in the office, and I think people are like, what is prehab? So that is my definition, catching that problem before it becomes an injury and allowing you to enjoy life for the entirety of it, and not settling for less than what you deserve. So have a great day. Let me know if you have any questions.